Right, sir. So, hi everyone. We are live now on Facebook, and today we are going to be talking about obesity and its repercussions, along with the benefits of weight loss that you can experience with the hypertension and diabetes as well. Plus, we are going to be discussing on the role of balloon, which will help you achieve that weight loss. I am Prateek Mathur. I'm the founder and director of MOP Obesity, where we are actually giving treatment option and holistic obesity management. And along with me is Dr. Harsh Kapoor. Dr. Harsh Kapoor is director and HOD of Department of Gastroenterology and Hepatology at Mulchan MedCity Multi-Speciality Hospital. Hello, Dr. Kapoor. How are you doing?
Prateek. Hi, Prateek. How are you? It's nice to see you on this program. And
thank you for joining us and taking out time and working for all the awareness that we are actually focusing on right now. So we have been
maybe
yes,
I can just tell the audience what's the purpose behind this. We discussed as that.
Sure, sir.
So dear friends, what we thought was during this time, like we can't meet together. So obesity is one issue which is going to get worse due to inactivity. So Prateek and I thought that we will get together and give you an ongoing basis the issues which are involved along with obesity, mainly gastrointestinal problems, and highlight the other problems which can come with that too. And on a weekly or bi-weekly basis, we'll pick up one topic out of the gastroenterology which is associated with obesity, and we will give you the tips how you can manage those during this time.
Right, sir. So we have always heard that, obesity, we've been told several times that being obese or overweight is bad. But, as an audience, do you know that how much damage obesity has on your health? And today, what we are going to be discussing, it would be an eye-opener for you to be fit and not be obese. So, sir, because there are different kind of meanings and definition of obesity running across. So, in the simpler terms, how would you define obesity? And maybe if you can just throw light on how obesity is going to be affecting our health and increasing the comorbid conditions.
That's right, Prateek. Very nice question. But to begin with, I don't like the word obesity. As soon as a patient comes and sits across my table and you start using word obesity, I think I have seen they won't say it because they know that is fact, but that puts them off.
Correct.
So, and the problem is if we tell them only overweight, then we are not justifying, because at one point overweight finishes and obesity start.
Correct.
So maybe sometimes I use the word as morbid obesity, a morbid overweight, and just to take around, especially for people who are more sensitive. But I think in future we should probably have a more medical orientated terminology so that the people are not offended, because obesity is a word which is layman terminology.
Correct, sir.
Now your second question was how we define it. So science is all evidence-based. We cannot say, looking at person, that you are overweight, you're obese, or you need to do some. And he's going to ask you, sir, what is the proof for that?
Right.
So science is on the basis of body mass index, BMI. We have categorized the people into 4 categories. The first category is if your BMI, which is calculated by taking your height and weight and put into a complex formula, it'll give you the results. If your body mass index is less than 18.9, then actually you're underweight. So you would need to gain weight to come to an appropriate body mass index.
Right.
Now, if you are from 18.9 to 24.9, then you are in an average, okay type of body mass index.
Right.
Now, if you go from 24 to say 29.9, then you come in an overweight category and you need to correct weight. That's a time, it's a warning that you're going to get into trouble.
Right.
Anything beyond that actually scientifically is obesity, which need probably some intervention immediately and maybe a couple of interventions if the person has failed to do the simple home remedies.
Right.
Now, there is another way of getting the overweight kind of a formula, which quickly I use if I don't have a computer. That is taking your height into centimeters and taking the first one out of that. That is your ideal body weight. So let's say somebody has 155, then the ideal body weight will be 55. But this is less sensitive than body mass index.
Right. So, so is this like the correct method? Because, you know, I have, in my experience as well, that most of the physicians are actually using BMI as their ideal or your calculation for the BMI, or, you know, calculating the obesity or overweight. But there are other things, as you mentioned as well. But, you know, for the audience as a layman, I mean, the ideal calculative method would be the BMI, which,
exactly,
of course, which we can obviously work it out.
I agree with you. That's more scientific.
Right,
but if a person comes to your office and you don't find a major issue, then quickly in your mind, you can say whether you're in trouble or not.
Correct, sir. So, because of course, I mean, I would say, I mean, as you rightly said, we are not going to be talking about obesity. If we can obviously, you know, talk about, you know, excess of body fat or excess of body weight, that would be appropriate in terms of putting into the mind of the people that, you know,
I like it.
Right. So, yeah. So that is more appropriate, I guess. So, when we are talking about, you know, excess of body weight, of course, you know, weight comes with other, you know, diseases along with it. So can you please, you know, enlighten us with all the diseases that we can, you know, incorporate, or, you know, when we have excess of body weight, sir?
Prateek, it's a very important question. I would say that you have hit the nail on the right place.
Right.
And you got to give me around 5 minutes to kind of fully go into the detail.
Sir, your time.
Thank you. So, obesity or overweight or excess of fat is not a single issue. It's a host of problems started in this person, and then they're going to affect different vital organs, different body parts, and give you different problems. So I would say 90% of the diseases in a body would come if you have obesity as the baseline problem. Now, the major things which we talk about obesity comorbidities are diabetes, type 2, hypertension, and then cardiovascular disease.
Okay.
But if I have to enumerate the other problems which are also associated, not in everybody, but in a less probably percentage. If you start from top, depression is a big issue.
Yes.
Eating habit disorders, another issue. Right. Endocrine dysfunction, where you can have things like Cushing's syndrome or hypothyroidism overlapping and give you probably a cause of obesity on top of that. And then a lot of skin problems can come due to obesity, and the swelling and immobility will bring you osteomalacia, arthritis, and mainly because of your weight putting on your joints, which are not meant to take that kind of a weight, you will find that these people will have a lot of problems with the knee, hips, and elbows, etc. Right. These people are also very low on life. Their intimate relations are disturbed. Their fertility rate goes down. Right. Then a host of issues come in their life which complex and make it very difficult to carry on, and they go into major depression.
Correct. So, I mean, of course, I mean, there are plenty of comorbidities attached to the excess of body weight. So today, I mean, of course, it's not possible for us to actually keep emphasizing on all those details. So how about we take it like step by step? We can maybe talk about the hypertension and diabetes, which is the major issue right now. Diabetes, of course, India is now growing population of diabetic along with excess of body weight. So we can maybe, talk about how obesity increases the risk of maybe diabetes or type 2 diabetes.
I must admit, I missed one thing which I should have mentioned is gastroesophageal reflux, which is a big issue with that. And in our subsequent talks, we'll take one day just to talk about gastroesophageal reflux.
Absolutely.
Now, coming to diabetes, as you asked, and there are two kinds of diabetes, as all we know. Diabetes type 1 is actually the insulin deficiency, so has nothing to do with obesity. This comes in during childhood, and it's a different kettle of fish.
Sure.
The second type of diabetes is type 2 diabetes.
Right.
What happens in that is you have enough insulin, but insulin could not find the receptors where it has to work. And they are all masked by the fat and all obesity issues with that.
True.
Now, this diabetes will gradually get worse with increase of weight. And you won't be surprised that people might get improved and get off the medication at times also in small number of cases, but their dose will certainly decrease when they lose weight and they do get into intervention.
Sure.
As you and I have seen many cases after we have made the patient lose around 30 kilos or so by putting a gastric balloon. A lot of people stop taking medicine for type 2 diabetes, and some of those required a very small amount of the medication. So certainly the weight loss is a major issue in patients with obesity.
Right, sir. So, of course, because we have seen that, diabetes and everything, in our experience as well, since we've been doing the balloon program together, even a small weight loss of 2 to 3 kgs will also help in, putting the insulin level down and, treating up the obesity or the diabetes as well, I would say. So, this, of course, because there would be link between diabetes as well as some heart diseases as well, because it is a chronic thing, because we are experiencing, in India, many of the patients are diabetes because of the intake of so much of the sugar, and of course all the calories that we take. So, of course, there would be a link between diabetes and, some of the heart diseases. So can you elaborate on that, sir, as well?
Okay. Before we move on from diabetes, and you raise an issue about Indian diet, I think it's a right point to mention that Indian diets are very rich in carbohydrates.
Correct.
And carbohydrates get into sugar, as we all know.
Right.
So, truncal obesity is a very big issue in Indian population, to an extent that we are becoming the diabetic hub of this world.
Absolutely.
And you will find a lot of patients does not look overweight or BMI more on an appearance, but when you calculate that, because they are hiding all the weight around their belly. So that is something we have to keep in mind. Now, if we talk about cardiovascular problem and hypertension together, we have to keep in mind that these people also have dyslipidemias. So they'll be very high triglycerides and very high LDL. And because of inactivity, their good cholesterol, HDL, is low. I would take 1 minute to explain how LDL and HDL work, so that the audience can understand why LDL going is bad and HDL going down is bad.
Absolutely.
Now, it is like a carrier. LDL will take the fat to the distant arteries, in the coronary arteries, in the brain, to the smaller places where the artery is certainly at the end of the organ supplying the blood.
Correct.
Now, this fat will go there, do its job of giving calories what it is required, but the excess will become a plaque there. Now, if you have good quality of cholesterol, which is HDL, high density lipoprotein, it'll bring it back.
Correct.
So it is like a scavenger, which is taking the fat back from those places. And
Right.
HDL, as we know, can only increase in body by two ways. One, by exercise, and our obese population, actually due to weight, are more inactive. So
Yes.
it goes down.
Yes.
And
Yes.
secondly, the only way you can increase is a glass of red wine, which has studies have shown that is
Sure.
one of the source. So I would recommend the other one than the red wine, but as it is mentioned in literature, I thought
Right.
I must tell.
Of
So
course.
once the arteries become hard,
Right.
then start the hypertension,
Correct.
because blood pressure is a sum of cardiac output and the peripheral resistance you have.
Right. Right.
So then you get hypertension.
Correct.
That is a big problem. And then hardening of arteries, plaques getting narrow, blood not passing through in the
Right.
heart will give you coronary artery
Sure.
disease, and in the brain it'll give you stroke.
Okay.
So basically, in very simple terminology, this is how the whole system involves hypertension, dyslipidemia, and coronary artery disease and
Right.
stroke.
Right, of course. So, because of course, I mean, we have seen in our near and dears one, as well as in the news channels, that many of the young patients are actually getting the heart attack because they are overweight or because they have the excess of the body weight. So I think you have explained it in a better way, of course, that what exactly is the root cause for getting to the heart diseases
So
as well.
Prateek, what you're trying to tell me is that young patients are getting disease of the older people. So I will put it in this way, that they are young by age, but caged into an old body.
Right.
Because you have all the things in that body which doesn't fit to your chronological age. And
Right.
that's why they're getting old age problems at a very, very young age.
Right, sir. Of course, I mean, we've seen that, genetics also plays an important role in getting obesity passed from one generation to another as well. Because if you're
Exactly.
having like one or both parents, or even the near ones, like, aunt, uncle as well, obese, you can also get that obese, like, diabetes or hypertension for that matter.
We have not found the gene, but we know mutation. But we know that their genetic is a big thing in obesity. So
Correct.
all people who are obese, they are not due to their own problems of eating more or inactivity, although
Right.
over time they become part and parcel of them. But the childhood obesity, which is a big problem nowadays too, you see in people with genetic problems, and you'll find that the many patients in the family will be obese, and the children from very beginning in the life, in spite of a good healthy lifestyle, will get obesity. So genetic is a major component which we can't change, but we can lose weight in these people and then very strictly put them on good habits of eating and lifestyle to maintain that weight.
Absolutely, sir. So, I mean, because coming to the major topic that we have right now is that, getting into the benefits of the weight loss in the treatment or the cure of diabetes and hypertension, I would also like to tell the audience that you can also write in the questions and your queries onto the comment section, so that Dr. Harsh Kapoor and, some of the questions can be answered by me as well, because I've got some of the little experience that I have for the past 13 years, which of course I can share as well. And so if you can write your questions and query onto the comment section, I can directly ask Dr. Kapoor as well. I can be the moderator and asking questions to Dr. Kapoor. And of course, Dr. Kapoor would be very happy to answer them as well. So, so now coming back to the topic, sir. There are benefits, of course, of weight loss. So could you please elaborate and explain us the benefits of weight loss, which could be useful in the treatment of hypertension, and diabetes as well, sir?
Prateek, the way you put this question astonishes me. There is no loss in losing weight. It's all gain.
Absolutely.
And to begin with, by losing weight and coming back to the shape, you certainly increase your life.
Right.
You avoid a lot of comorbidities.
Correct.
You enjoy your life more. And the last but not least is it makes you socially more acceptable and family life becomes more pleasant. So if you tell me that what are the gains, I would first of all say there is no loss in this. Everything is gain. And depending upon at what stage you come to us, we have to take action accordingly. And we have talked about BMI that guides the doctor to suggest what modalities do you have.
Right, right. So this way I could actually, interpret is that, this time losing is not a bad thing. So it is good to lose, not in terms of course but losing weight as I'm saying. Right, sir. So this way, what we can obviously work it out that there are lots of weight loss method. Not many people know. Physicians tell them to lose weight. If you are a diabetic, if you are having some of the problems like PCODs, or you have some problems of even hypertension and sleep apnea, they say that you should lose weight. But how and where to send them, they are not very much aware of it. So could you please also tell us, where and what all weight loss methods that we can actually adapt to, get into a fit and healthy lifestyle?
Prateek, first of all, when a thought comes to a patient's mind that I need to lose weight, you must pick a doctor who can spend time with you. It's not a condition where 2-minute consultation will help you.
Sure.
Secondly, who has experience in this field. Obesity treatment has gradually become more specialized.
Right.
And number 3, that you have trust in the doctor so that whatever he says, you will do it, and he can produce results. So unless you have these 3 things in the doctor-patient relationship, I think it is tough to lose, because after a certain point, people give up.
Correct.
And they think that there is no return from here.
Sure.
And thirdly, if they come too late and it takes too long to show benefits, they lose trust very quickly, because as a human tendency is that we want quick fix, which is not a case here.
Right.
Now let's go back to our BMI. If a person comes to me between 18.9 to say 24 or so, I say that you're overweight. Let's do something. A good history of the patient will tell me how he's eating, his genetics, whether this is coming from childhood or certain event in life happened that the person start getting very inactive and getting polyphagic, eating too much, and got into that. So a good history will tell me why this is it. Right. And then a basic lab workup will also tell me that whether the patient is diabetic, hypothyroidism, Cushing's syndrome, which are contributing to this.
Right.
So in this range of BMI, that is my approach. And I always do on all my patients a quick depression screening to make sure if it's a young person or a female and they are having social problems with the peers, and they go into these kind of problems very soon, and they get into insomnia. That means they don't get good sleep. So and diet habits. Right. So after having that thing, if they stay in this BMI when they have come to me, I would start with their dietary habits, their exercise program, and correction of their endocrine deformities if I find some, and give them 4 to 6 weeks and see how they are doing it and how their morale is coming up.
Sure.
So maximum you can give 3 months, and you should make small goals which are achievable. Sure. I'm not going to tell them that you need to lose 10 kg and in first month you want to lose, or you can lose, or you must lose 5 kg. That would be wrong. Right. The incremental scheme of the thoughts of making the goals is the right way, because if you're going to lose 3 kg and you lost 4, it is a added point. But if you say, I'm going to lose 5 and you lose 4, that is kind of a disappointment.
Correct.
So it's like we give our children some stars when they get good marks and put it on the refrigerator and then treat them after a certain time when they collect so much. That should be the approach to them.
Sure.
Now, if they fail here, or when they come, their body mass index is, say, from 25 to 30, I would discuss with them and see their enthusiasm. If they haven't done anything what I have told them before, then I will tell them, listen, why don't you try? Any doctor who would start telling them about various procedures to be done in the first visit, not taking a good history, the patient will lose confidence. To begin with, since I've come to India, I found that patient-doctor confidence is a little bit shaky. So they start thinking, doctor is pushing me for these procedures and all. You have to bring that patient to a level where he thinks and agree with you that now intervention is required.
Correct.
So if the patient has done everything and has been referred to me in between this body mass index or more, then I will start talking to them about what to be done as a procedure-wise.
Sure.
How can your scheme of thoughts of diet, exercise will be complemented with instrumentations, which we are going to do some procedure to get you results so that you feel that you're getting somewhere.
Right.
So any weight, a loss of initial program or any body mass index from here onwards, maximum up to, say, if I have to lose 30 kg or 35 kg, gastric balloon is a very good option.
Right.
And I'm not saying because we do it or it is more commonly available. It actually produces results. What it does is that it gives you an option to not to have any surgical intervention.
Right.
And every anatomy inside would stay same.
Correct.
And secondly, the balloon will be out in 6 months' time.
Yes.
Once you have achieved the required amount of weight loss. And you have a future option. If you say you thought I'm going to lose 25, 30, but you lost 15 and you still want to lose, you can have another go at that after a couple of months.
Right.
So that would be a transient way of using gastric balloon. Now, gastric balloon can also be used in patients who are like 150 kg more to bring them to a stage where they can go for surgical interventions.
Yes.
Now, soon, I hope so, with Corona, it might be delayed, a sleeve is coming where there will be a plastic tube placed into the small intestine.
Right.
Thereby, no absorption of the food can be done.
Correct.
And then you pass the stool more without absorbing the food and fats, and you can lose, but that is not available at the moment.
Okay.
Now, there are some other drugs available which are fat binders, and some people in the West have used them to have more stool, not absorbing fat.
Right.
But they are not helpful in the weight group we have talked, because this is how I tell my patients that you open a saving account, you put money, you spend, the balance is zero.
Right.
But what happens to the fixed deposits you have made over the years? How to dissolve them?
Correct.
And when you are so heavy, you really cannot do very extraneous exercises because you get tired, and you're hungry because extra fat cells are also asking food.
Correct.
So unless you intervene by some way, it is not going to happen. And I'm sure you're going to ask me how gastric balloon works. Maybe I can answer you that too.
That was of course, the question that I was about to ask, of course, because many of the viewers would be knowing that if it's a non-surgical technique, how is it going to go in, what is going to be, how is going to be, limiting, or how the balloon is going to help you achieve the weight loss, and how it is removed after 6 months if it is.
Exactly. So the first of all, you don't even have to get admitted to the hospital for that. It can be done as an outpatient. Although in my practice, after putting a gastric balloon, which takes me around 30 minutes, I keep them for observation for 4 hours. That's my personal choice because they can have some nausea, vomiting. I can take care. A lot of people don't do that. Now, gastric balloon is put with an endoscope, just like we do endoscopy. There is no cutting or stitching in that. And we place the balloon at a certain place and then inflate it with the liquid inside, a special colored liquid. And then it goes and fixes in the fundus of the stomach. And then we come up.
Right.
Now, what it does 2 things. And third thing, maybe we do not know because we are learning more and more. The one thing it does is it expands our stomach. Right. So whenever we eat, our stomach expands and we feel that we don't need any more eating. So if your stomach is already expanded some, then a little bit food which is coming down, which will give your hypothalamus in the brain a message that there is a satiety, that you are no more hungry. So that is one way. And then because you're eating less than your required amount to that body weight, you will be losing weight. The second thing is, like in surgery, we make the passage of the distal esophagus narrow so that the food can go only very limited in a semi-liquid or liquid form initially. And then people will, if you eat for too much time, you get also satiety.
True.
And that's the other way. It will give you that narrowing of that area where the food will go down. It will fill up soon and you will not be able to eat. Yeah. Now, I must tell you, the gastroenterologist and you as an expert, as a technical help is one part. There's a major part done by our dietitian because we got to make sure that they get adequate amount of calories to survive. They also get first week, second week, the things they can eat because they are new to balloon, and then gradually we increase. And number 3, they also get adequate essential vitamins and nutrients so that they don't go to weak.
Sure.
So if a person in obesity treatment has to stay hungry, they will give up. So in our program of gastric balloon placement, we tell patients firsthand that you will never be hungry, but you won't need much to not be hungry. And that's how it is going to work.
Correct. Sir, if you may allow me, I can also share my experience because we've been actually working on intragastric balloon and I actually introduced it here. We were first, obviously, just selling up the balloons. Now, that was not helping in the total overall body weight loss. And the amount of the weight loss was there, but the amount, it was not that much that to affect the people in a better way. So we formulated this program so that it has to be a multidisciplinary team. As Dr. Kapoor also said that, every detail is essential. A doctor is essential for putting in the balloon. The balloon is essential for making you lose weight. A dietitian is important before and after the balloon has been placed. But you as a person who's going to be enrolled as a program is also very important, because if you're not going to be willing to lose that weight, or you're not going to be, willing to follow that norms that we are going to be putting in for you, it's not going to affect. It's not going to affect in any which way. So, sir, if I may quote, Professor John Dixon, who's a bariatric physician in Australia, once mentioned to me that, weight loss programs should be like rowing a boat. So everybody in the team should be rowing in the same direction. If one of them is rowing in the opposite direction, the boat is not going to move, or it's not going to be effective as rowing in the same direction.
Very well said.
So this is what actually I wanted to, interpret into it, because, balloon, we've been selling it on a regular basis and everything, but the satisfaction that I got after making up a program of obesity, that actually helps a lot, because now more people are satisfied. There is more of the sustainable weight loss even after the removal of balloon, because that is the first question that comes into the mind of the people. What after removal, sir? So
Prateek, I think a lot of audience, before we go to this question,
yeah,
because we are going like a story, you have put in the balloon.
Absolutely.
The thought they may come to their mind is, what are the complications?
Correct, sir. Absolutely.
Okay, am I going to have any complication of putting balloon, or any risks or so?
Right.
So I would like to say that the procedure is very smooth, although it is very dependent on the expertise of the physician who is doing it, and the technical help doing it. Now, you and I have done more than 100 cases or 150 cases.
Yes,
we are very slick, but when we started, we did had a little bit of cough or a little bit of irritation in the throat, which doesn't happen now.
Correct, sir.
So basically, the procedure is very, very smooth, and balloon has no side effect on the patient.
Yes.
Now, there are certain balloons available which can be readjusted. And I do not like them, because when patients start looking at comfort and you start giving them comfort, then you start compromising with the results.
Correct.
So we do not prefer, unless patient insists, the balloons where you can deflate and from time to time. Those results are not matched well.
Sure.
Now, the maximum, which I have never seen in my 27 years of experience with the gastroenterology and doing this for 15 years, that a balloon would bust.
Yes.
But theoretically, some people who are using Chinese balloon, which are cheaper and with a thin walled, if that happens at the most, the color of the fluid will come in the stool, you'll come to know, and you will remove the balloon a little bit earlier than the required time.
Correct.
So basically, there is negligible any side effect from these balloons at all.
Right.
So I would say that one thing you can take it, there is no life-threatening complication. There is nothing like that to be scared of.
Sure.
You have to be in the program, see your doctor, report your weight loss, follow the dietary. As you said, it is a team approach.
Yes.
If we pull the rope from other side, then we are not going to get results. We got to be pulling on the same side, everybody.
Sure.
Now, the next your question was, what will happen once we have reached the time to remove it? So maximum life of this balloon is 6 months.
Right.
And we will remove after that time, if not earlier. Suppose we say we want to lose 20 kg, and in 4 months, many of my patients have done, and they say, Doc, I don't want to lose any more weight. Then we are ready to remove the balloon earlier also, but 6 months. And the reason for that is the wall stiffness goes away after that.
Yes.
And we are into major trouble after that. So we should not be extending too much after that. A week or 2 weeks, international patients, we can always accommodate.
Sure.
Now, the removing, again, is a very simple procedure. Through gastroscope, we put a needle and suck all the fluid.
Right.
And after that, we have a grasper, and we go in and clip it on the top of the balloon and pull it very gradually with rotating movement. And once your physician is very expert in this, it takes less than 10 minutes to finish everything.
Correct. Sir, I think there's a problem. Guys, I'm sorry. I think there's a problem with Dr. Kapoor's internet connection. So maybe I can put in. Hello, sir. Can you hear me now?
I can hear you.
But I can't see you, sir. I think the video has been paused. Yeah, the video has been paused.
Paused.
Yes. So, I mean, you can continue. I mean, we can obviously work it out in a later stage.
Mm-hmm.
Yeah.
I'm just.
Yeah. Now
okay.
now it's clear. Now we're live.
Okay.
Yeah.
Okay. So what I was saying is that the both putting and taking out, we do in mild sedation where we don't give too much anesthesia. But if somebody is very apprehensive, we can do in a deeper anesthesia, although it will increase the cost for no good reason.
Sure. So just to take it forward, actually, balloon is a very simpler process, though, as mentioned, it's going to be just about 10 minutes of insertion and removal both, again, with an expert hands. So we have to be very, rightful in making decision of where to go and put in the balloon. And, balloon is only a tool to induce your weight loss. Rest, of course, everything has to be done up by the team as such. And by team, I mean that you are, as a person or a patient, is also part of the team. So if we need to work up in tandem to induce your weight loss for a sustainable weight loss, I mean, I'm not talking about, just after 6 months that balloon is removed. What after that? I mean, it could be a yo-yo effect. But in our experience, we have not seen people going back to their original weight. We have seen.
Prateek, can I cut you a little bit?
Sure, absolutely, sir. Please.
The reason I want to cut you is that after you remove the balloon, your association with the doctor doesn't finish.
Exactly.
If that finished, you are in a major trouble.
I was coming to that, sir. Yes.
What happens is that the team has to follow that patient for his or her dietary habits.
Correct.
Closely monitoring the weight. And I tell my patients not to weigh every day.
Right.
What they have to do is Monday and Friday, they will pass the stool in the morning, early in the morning, and without clothes, they will maintain the weight and they put on a chart. And I'm not worried about one day 200 gram going up and down. I want to see how the graph is going. If the graph is gradually going down, I'm happy with that. But if the graph is going up, then there is a trouble. And if you weigh with the clothes, one day you have a higher, heavy clothes, and other day you have lighter clothes, that can also skew the curve.
Sure. So we have actually, talked about all the topics that we had, of course. So if you may just, have a conclusive talk, or maybe we can have some questions, because I have received so many questions, so we can maybe go into the question.
Briefly, I will conclude is that obesity should be treated not a cosmetic problem, but a disease.
Thanks.
It has dire consequences if not dealt. It will go from stage 1 to 2 to 3, as we said, in due course of time. Wherever you can stall it, that is the best way to do it.
Sure.
And people who are in trouble, they should seek help, and the help should be sought from the people who are trained in this field.
Right.
Because the last thing you want is you're doing your effort, you're going to a doctor, you're doing everything, but you went to somebody who doesn't have this experience, and it'll delay your process, and your weight gain will be further. And the other thing is, you will need an internist along with that, which we will introduce you to have the comorbidities treated very well. Because while we are losing weight, while we are fixing the problem, you don't want end organ to be damaged by that time. So that what will happen is, once you have lost weight, but you have already damaged something, which is not good. So my advice to people are, don't rush for any cosmetic thing at the first go. First, let your doctor evaluate your problem, see which stage you stand, then give the simpler diet and lifestyle modification a chance if you fall in that group.
Sure.
And if not, then while doing that, do the intervention. And we talked about balloon because that's our area of expertise that you can avail. And I would tell the audience that Prateek has a vast experience in counseling the patients, and he helps me as a very skillful technician while doing the procedure. And our problems have gone almost to zero unless the balloon is defective or something before putting, which we check. Patients are very happy, and we do international patients, national patients from Gulf, Middle East, Europe, and some of the patients have even come from North America.
Yes, yes. So, sir, we can actually start up the questions because we've received many questions now going live. That is the advantage. So first question that have come across is that how should we keep a check on our mental or state when suffering from obesity, since it impacts the health, sir?
When a patient comes to me with the physical checkup, a mental checkup, which I have made a series of questions, or you can have a questionnaire for the patient to fill to see that. Right. If you find patient is a little bit down, you can manage. But if they have a major depressive illness, I think from very beginning, they should be associated with a psychiatrist or a psychologist along with us. While we are giving them hope, we are reducing their weight, they also be managed with that. And we can discuss about those drugs and all at a later time. Now, if the depression is to extreme and they have suicidal tendencies or so, we may have to wait for the treatment of the obesity and get them a psychiatrist, bring them to a stage that we can move on.
Correct, sir. The second question that has come up is that what is the connection between the lifestyle and obesity and overweight?
See, the thing is, as I told you, if you open a savings account, the amount of money you put in and the amount you spend would tell you what is the residual account value is left. So if you're putting in 2,000 calories and you're only spending 1,000 calories, you have a couch potato kind of lifestyle, watching TV and eating chips and all, then you're gradually going to gain every month more and more. That is one thing. Other thing is hormonal changes in your body, especially women when they go through menopause. And even otherwise, like you talked about PCOD and all, those kind of things. If patient gets diseases like hypothyroidism, Cushing disease, they can give you so much weight. And you're talking about treating for obesity, but if you're not taking good consultation and a history, and you don't treat that, then that would be wrong approach, because weight gain is not coming from anything else but due to that disease. If you cure that hypothyroidism, Cushing disease, and the patient might lose a lot of weight, and you don't have to go to all these interventions.
Correct. Sir, if I just add on, because of this pandemic, most of us are having the sedentary lifestyle. So could that be, of course, be hindrance or, an excess or,
I think your video is frozen.
I'm sorry. Is it fine now, sir? Are you able to see? Because we are absolutely fine. I think, sir, the connection is from your end is not that good. Hello. I think Dr. Kapoor has held up. So what I was actually saying is that, because sedentary lifestyle also holds an important part in having obesity or overweight gain. The weight gain is very much high when you have a sedentary lifestyle. And because of that, you'll also have a binge eating. So binge eating also, incorporates into a weight gain as well. So sir is back. Dr. Kapoor is back now, and we can obviously go to the next question. Is that it's not exactly a question, sir, but it's a comment that a doctor, don't you feel a little hand holding is required by the individual to guide them through the weight loss activity?
Of course.
Yes.
It's not a treatment. It is like a team approach. Like you're going to play cricket. Somebody has to do fielding, somebody has to do batting, and somebody has to do bowling.
Yes.
If one person try to do that, that's not going to work.
Right. So,
so first of all, a good history and information, and all the options patient do have must be given to the patient so that they can really, really think and be a part in decision making. It's not like they come to me and I write antibiotic and they have to take that.
Correct, sir. And There's another comment which has come up because not many people are comfortable talking about their own overweight or weight gain or obesity. So how do you actually tell them to come to a doctor? Because still people are not considering overweight or obesity or even excess of weight gain as a disease. So they are actually doing all the shopping or a window shopping even for going to a gym, going to a non-medical weight loss program as well. How do you see that? How do you tell them that you have to come to the doctor?
See, Prateek, one thing, if a person is already doing window shopping and going to gym, it is very good sign.
Yes.
For their success, because they have accepted that I have a problem.
Correct,
and
sir.
I need some kind of a remedy. So they have started their own effort. If they would not accept it that I have a problem and by putting loose clothes and hiding, then that's a bad sign. But a person
Correct.
like you have explained that they're going to gym, they're funding window shopping, fine. The next thing is they need to have education. So the seminars like we are doing today, or you and I go and do in periphery, so many programs in clubs, in gyms, you and I have done so many programs. Those are the ways to educate people by writing articles that if you have exhausted your option by yourself, this is the time to come and take an opinion.
Correct. Many people have actually come to me, sir, in my experience is that, they don't accept that they're overweight or they don't accept their own, I would say, their own mistakes. They say, I don't eat much, but still I gain weight, or I'm knowing everything possible, but still I'm gaining weight. How this, the program will affect. So
Prateek,
what?
This is a very good question.
Yes.
And it needs to be handled very sensitively.
Correct.
If somebody comes to you and your opening statement, you're obese and all, they'll be put off from.
Absolutely.
So if they don't accept it, you need to spend time. I don't know. I tell a lot of doctors in CME that you can charge more money by spending more time with the patient, but don't rush them, because this is not 2 minutes job. You got to sit with them, talk with them, take a dietary history, calculate the calories, and then tell them, listen, your requirement is this much you're taking, and this is probably adding on to your body, not using word obesity, as I told you in the beginning.
Absolutely.
And be sensitive about their feelings also. And then gradually bring them to a state saying that, not using obesity, this overweight, I can help you with.
Correct.
If we work like that and start from small things, first day you don't talk about bariatric surgery or gastric balloon or sleeve or other big things. Talk from simple things and then gradually bring them to a stage to emphasize that you're not at a stage that this only is going to help you.
Sure.
And this will and take them through to a program where a dietitian meets them. You keep a weight chart, they bring it for a month, and you tell them, listen, it's not helping. And you talk about dieting, you talk about exercise, but in a gradual manner. And this has to be a patient-specified speech which you give it to them, because not all patients are ready for your big, heavy-hearted speech on the first day.
True that. So, I mean, if I may add also, because many of the patients or many of the persons who are actually obese do not accept that they're obese. They say that in Hindi what we say is that hum khate pite ghar se hain. So I think social surroundings also play an important part of them realizing that they are having an excess of overweight or
this is same like if you take out the social stigma.
Right.
Then the patient will come. Like an alcoholic comes to me.
Right.
Say, Doctor Sahab, thoda sa peete hain. But when you actually take and quantify and you tell them, listen, I'm not worried about the pegs you're taking. I'm worried about the proofs, which is the concentration of the alcohol. I'm worried you're a liver can't take. If you talk like that, you don't have to humiliate a patient. Every time using a word obesity. If they say, listen, I'm not obese, you say, yeah, okay, maybe you're not obese, but I think BMI is a problem.
Correct.
Weight is an issue here, and
Yeah.
how to handle it, let me guide it through.
Sure.
If you say the same thing in a very acceptable way, they'll like you and they'll come back and they'll work with
Absolutely.
you.
Absolutely, absolutely. In our experience, also, we are actually, taking them as a very light thing. I mean, we're not pushing them. We are not, scaring them away. Of course, it is a scary topic of being excessive overweight, having all the comorbidities attached to it. But, as a person, when you're coming first to the doctor or first to the counselor, even, you do not want them to be scared away. You want to make them feel like, at home itself, talk about their own lifestyle and, their own eating habits and everything. And, sometimes, dietitian gives them the specific food for maybe a month's time. I always say that, I cannot be on a GR diet for 1 month, so I'm not going to give it to you. So it's more of the confidence that they have on you is what going to be the success of the weight loss that they are going to be achieved after that.
I
So
agree
this
with you.
this is something I also practice in my when I'm counseling of the patients as well, because you need to be a friend, you need to be a team member of them, not to scare them away. And
just imagine the
yes.
first day a child goes to school.
Right.
How the teacher entice that child.
Correct.
And make him look everything rosy. The same
Right.
thing, you have to give a good attention.
Yes.
Hope to the patient that
Yeah.
things are going to work it out. And once you start doing that hope, I think then it is going to work it through.
Absolutely, absolutely. So another question that has come up with, so it's the reversal one. So we have heard that it's that with the obesity comes hypertension and everything. So the question is that with the high blood pressure medications, is it hard to lose weight, because also that also increases the overweight or gain of weight?
To answer this question, there are a couple of things you can do, but keeping one thing in mind.
Yes.
Weight loss or no weight loss, your hypertension has to be treated.
Correct.
But you can discuss with your internist. There are many classes of drugs. If you don't want to use beta blockers, you can go to calcium channel blockers. You can take ACE inhibitors. So your doctor, according to the need and requirement, can go to a different class of drug.
Correct.
And that way, things can be minimized. Every drug you take, there is a side effect from that.
Right.
Diabetic drugs you take, there is a side effect to that. And then we didn't talk about renal complications with obesity. So a lot of drugs have renal issues too, toxicity. So once you take the medications, there are some chances you have to take, because no drug is absolutely side effect free. But most of the time, the art the doctors have learned is to choose the drugs to minimize any complications to you.
Sure. If I also may add is that, because if you're overweight, so losing just about 2 to 3 kgs can also lower the blood pressure. It may also be possible, to reduce your dose of blood pressure medicine as well. So I think, weight loss is the solution actually to many of the problems, of course. So we can obviously, elaborate into or the different meetings, how to go about it. We're going to be talking about. So this is not going to be the last of the session that we are going to be having. It's just the first. And we are going to be coming up with new topics, of course. So another question, which has come up is that, many of the patients, it's just a self commitment that they lack, because they say that, I can lose my weight with diet and exercise. What is the need of any procedure or to come to a doctor? So how do you handle that?
I tell them, listen, you will decide it.
Yes.
If you can do it by yourself, good luck.
Correct.
I'm very happy for you. But
Yes.
if you can't do it, and your labs are showing some derangement of reports,
Exactly.
and your blood pressure medicines are going up, diabetic medicines are going up, then please don't ignore, because as I said earlier, no point coming to a doctor and getting result done when the end organs are already damaged.
Right. So I always also say to my patients is that, if you are coming to me, that means you have not done something right. Right. You have done something wrong. So that's why you are here. If you have done everything right, you wouldn't have been here.
Prateek, I would like to say,
Yes, sir.
Never use negative terminology to the patient. That you
Absolutely,
have
sir.
done something wrong or not.
Right.
I think you should tell them, listen, I think you have done everything, but more needs to be done and you need
Correct.
help for that. Always be positive with the patient.
So that is well noted, and I'm going to be writing it right down in front of you as well, so that
Sure.
I can, excel in other things as well. And the next question that is coming up right now, sir, is that, how do I know if balloon is the right procedure for me?
See, again, I said that this is a decision you have to make, consulting your doctor and counselor, person like you,
Yeah.
and asking question.
Correct.
If the doctor thinks this is good for you, so that is first thing.
Right.
Then next thing is for you to get convinced that what doctor is saying is right. And
Right.
that can only be done by knowledge. The doctor
Correct.
has to explain to you, talk about BMI about that you are in that range, that you need intervention. And if you need more than balloon, then what balloon can do in the interim time. And by discussing in 1 or 2 meetings, I think most of the people come to a term that they can do that. And then they have to look into the financial aspect too. And that for that, you can also do counseling for that.
Sure. And then the other question is that, will balloon affect the daily lifestyle of mine?
Answer is not at all. You can do whatever you want to do. Just, you're not going to put 100 kg weight on your tummy, that's all. But other than that, your gym, your treadmill, your cycling, and daily life, your intimate life is intact. You don't have to abstain from anything other than following the dietary advice.
Yes. So I just want to add that, you can do everything with the balloon. The only thing that you need to be careful is that you don't have to do all your, the gym exercises like crunches, which is going to be directly applying pressure onto the abdomen, or even taking the steam or sauna. So because balloon is made up of pure silicone, so you need to be careful of taking all the sauna or a heat belt or a sauna belt, which is directly applying heat onto the balloon, which is not going to burst the balloon, but it might rupture it. And that's why we actually add methylene blue with the saline. So if there is some kind of a leakage into the balloon, you will have a greenish in color of your stool or urine. So, sir, anything else that you want to add on to this question? Because this was the last question that we had. Then, of course, we can have the closing comments, and then we can switch off the Facebook Live. And
I think I lost your voice.
I'm sorry, sir. So I was just saying that, do you want to add anything about in this question? Because this was the last question that we have. Sir, can you hear me?
Can you hear me?
I can hear you, sir. I can hear you. Can you hear me, sir? Hello?
Maybe you can sum it up because I can't hear you.
Sorry, sir. So thank you all, of course, to come and, attend this webinar, because this was very important for everyone of us, even for you, to understand what exactly obesity or excess of overweight is. I'm not going to talk about obesity as a term because Dr. Kapoor has said not to, and which he's of course rightly mentioned. And so what we want, as a conclusive effort is that, you need to lose weight by some method or the other, be it diet, be it exercise, be it surgical, be it non-surgical. Everything has
Maybe you can do something to bring me back.
Sir, I can. I'm not able to hear you. Sir, I'm trying to work it out. But everything here is absolutely fine, sir. I don't know what is wrong. It might be the connection. Can you, sir, unmute it? Yeah. Can you hear me now? Hello? Can you hear me, sir? Hello? Hello? Sir, I'm not able to hear you. So I think we've lost Dr. Kapoor, unfortunately. But what I was actually telling was that, we have to do something or the other. And the whole point of getting this webinar is to get awareness onto you to pass on to you whatever the knowledge that we gained over the past 15 years of experience in this field, is to make you understand that you have to take care of your health, no matter
Prateek, you
what.
have disabled my video.
Sir,
Can
I'm
you
not.
check that?
Let me see, sir. Sorry, sir. Sir, can you, sir, it is not from my side. Can you see? Yeah. Can you hear me now? Can you hear me, sir? I'm sorry. So I just want to thank Dr. Kapoor to, join us and made this webinar possible, and to all of you to join us in, attending this webinar as well. And, this is not the last of it. We are going to be coming up with more and more topics, and we are going to be making you understand and make you aware of the epidemic that is obesity. So thank you all for joining us. We'll see you on the other side.